Let's jump into this explainer. What if the absolute ultimate medicine out there isn't a pill at all?
We're looking at two wild clinical reviews today asking, can working up a sweat actually outperform modern medicine? Get this, globally, sitting around costs us $27 billion yearly, and it spikes mortality by 30%.
Let's start with your joints. A huge 2025 meta-analysis looked at over 2,000 chronic low back pain patients.
They compared passive stuff, like getting a massage, against active physiotherapy, where you actually do the physical work.
It's a crazy philosophical contrast, right? Merely receiving care versus actively participating in your own recovery.
The winner? Active physical therapy absolutely crushed passive treatments for reducing pain. It even beat combined methods.
So moving fixes mechanical pain, but what happens when we prescribe exercise like a literal systemic drug?
Well, a massive review shows exercise works just like a magic pill across your entire bodily system.
For every tiny bump in physical activity, your risk of premature mortality drops by 10 to 25%. It attacks diseases at their root. We're talking lowered blood sugar, slashed cardiovascular risk, and torching visceral fat. Specifically, regular cardio shrinks waistlines by an average of 3.2 centimeters. That's actively reversing metabolic syndrome, guys.
Okay, let's look at the brain. Exercise is an undeniable frontline treatment for your mental health too.
Being highly active drastically lowers your odds of clinical depression and anxiety, all while boosting your working memory.
In fact, cardio boasts a massive 1.24 effect size for depression that literally rivals traditional antidepressants. So, if moving is the ultimate drug, what's the exact clinical dose you need to see these results?
The WHO prescribes 150 minutes of moderate cardio a week plus 2 days of solid strength training. It perfectly echoes that ancient proverb, true wellness requires both a healthy mind and a healthy body.
The clinical data is totally undeniable. So the only question left is, are you ready to get moving?